Before we had pings, the first 4 or 5 years I was here, we had no insight. Occasionally a hospital would send maybe a direct message. Sometimes we would get fax discharges. Rarely was it, our attributed patients, and rarely was it from the hospital that we needed. Without that data, we were flying blind. Patients are super transient. We would never know about the ones that were out of town, or they were in Florida, or they were on vacation. And then as soon as we signed up with pings and started finding out, our patients are from 46 states. So they're everywhere. The emergency room is frequent, and it's been just invaluable to supporting our tools. Prior to rolling out the service, we knew on our ACO, only about 2 out of every 10 were actually keeping a visit. And the average wait time in Georgia for the first visit from referral to visit was about 80 days. Since we've rolled out Bridge and really kind of streamlined that referral process, now our PCPs, instead of needing to find the right plan or the right specialist that might take the plan, see the right insurance, it's one referral. The Bamboo team is going to outreach that patient, assess them, figure out their needs. And we've seen that go from a 20% conversion rate to closer to 60%. And it went from 80 days on average to about 2 weeks on average. So we've significantly decreased that wait time while increasing the access point in general. It was the right move. It's eliminated care center work, right? So the clinics and everybody that joins us independent, they employ their own staff. So the time that staff can spend working on something else is invaluable. We went from, let's call it, a dozen physicians that were regularly using it to over 70% of every PCP or APP in the market has used Bridge at least once. And we've gone from 20, 30 referrals a month to a few hundred referrals a month, and it's continuing to grow month over month. Within Privia infrastructure, the ability to scale a solution like this without us having to buy a ton of technology or hiring a million resources or centralizing a care management or a referral team has been invaluable as well. So it's really a scalable solution that we didn't have a way to do before we started working with Bamboo.